डिफरेंट मैम। अगर वो डिफरेंट पोजिशन ऑफ गेज में डिफरेंट डिग्रीज होते हैं तो उसको हम इनकॉम्पिटेंट बोलते हैं।
Okay, very good. So the angle of deviation is nothing but the amount of the deviation. In other words, you can say also this. Okay, the amount of the deviation and whether it is converging or diverging. Okay, if it is same. Okay, so esotropia, exotropia, and if the 10% aptness in lever version and 10% aptness in dextroversion and 10% aptness in supraversion and depression, all these things, if they are same, so you can call those kind of deviations as comitant deviations. And contradictory to this, concomitant deviations means, so the angle of the deviation will be
different in
different cases. Okay, different in different cases. Okay, so now, so there are few people, so there are few people saying that the comitant deviation, okay, comitant or comitant strabismus is a result of horror fusionist and diplopia phobia. Horror fusionist or diplopia phobia means, what is mean by horror fusionist means avoidance of bifoveal stimulation or reluctance to see single or repulsion of images. Okay, horror fusionist, that means these people or the person or the brain, okay, is scared of fusing the images. Horror. Okay, so this word and this all these things came from that. Okay, avoidance, so they are rejecting or they are very reluctant to see the single. Okay, so why, so such kind of phenomenon or such kind of attitude or such kind of quality is called as horror fusionist. Okay, why this happening and what is this? So we'll look into this now. So the phenomenon and when will happen. Okay, so horror fusionist, is everyone clear with horror fusionist? Yes, it's nothing but avoidance of bifoveal stimulation or avoidance of fusion or avoidance of seeing single. Okay, you are actually refusing to see single or refusing to fuse the images. Okay, that is called as horror fusion. This phenomenon, this kind of phenomenon is called as horror fusionist. Okay, so when you can observe this is, or when you will see this is, the phenomenon can be observed when images presented to the eyes are moved slowly towards each other by means of haploscopic arrangement or rotatory prisms. Okay, what is mean by haploscopic arrangement? Anyone? Haploscopic arrangement.
10^4.
Yeah, okay. It is based on principle of haploscope, right? So if you are moving or if you are passing or not passing, if you are projecting the images slowly into the retina, and if you are moving slowly with the help of such kind of arrangement, that is, you can use this with the help of synaptophore. So if you are doing that, okay, so what happens? One eye maintains fixation and the other eye, so the image in the fellow is moved across the retina closer to the fovea. So just imagine, okay, I am moving the slides, okay, that is present on the synaptophore from extreme peripheral retina. Now I am slowly moving, and from extreme peripheral retina, it is coming closer to the central retina or the macula. Okay, so during this process, the one eye maintains a fixation. Okay, and the other eye, so while I'm asking the patient to fixate the image. Okay, so I'm I'm projecting the images how I'm projecting, such that the image in the fellow is slowly moving from the peripheral retina to the central retina. So what happens during this process? So if the distance between two images is gradually reduced, okay, so what happens at that moment or at that time, the two images separate more widely and no amount of manipulation of the device brings. And what happens? Superimposition of two foveal images. Okay, so when I'm doing this, usually in a normal scenario, what should happen? Now from peripheral retina to central retina, I'm bringing the images of the object from peripheral retina to the central retina, that is on fovea. So what it should, or what will be the next process? What should be the next thing? Okay, you are just seeing something that is in front of you, okay, with your both eyes. So what will next happen? What is the grade that happens? First grade.
SMP.
SMP and fusion, and then stereopsis, right? Okay.
Stereopsis.
Yeah. Okay. So now that is in a normal general scenario, but when I move the images slowly, okay, so from extreme peripheral retina to the central, so what happens? So now the brain will not fuse or will not encourage the stimulation of the macula. Okay, so it will avoid the fusion of the images. Okay, this phenomenon. So why usually in a normal scenario, so the images of the object will fall on the retina, then SMP happens simultaneously. You will perceive the images, then the images will pass to the visual pathway, and then brain fusion, all this, then achieving the depth and everything. Okay, but here if you slowly move, if you project the images slowly, and if the distances is slowly reduced, okay, from time to time, so what happens? This brain will no longer accepts the stimulation of the fovea, or in other words, will no longer accept the fusion of the images. So such phenomenon is called as horror fusionis. Okay, you know the horror fusionis means is nothing but the avoidance of the fusion. When it will happen means when you bring the images slowly onto the macula, onto the fovea. Okay, understood?
Yes, ma'am.
Okay. Now, what happens? Why it is not or why it is it is not fusing, or why it is happening is the change in the distance. Okay, you are slowly bringing the peripheral images to the fovea, right? So change in the distance, okay, of the double images to the double images. So usually what happens? So the brain, see, for example, I'm giving you two scenarios. I'm projecting the two images at a time on macula, versus I'm projecting the two images one time at macula and other time at the other than macula. That means, for example, extrafoveal point. So what the brain will perceive in the next case? What the brain will perceive? Double images or a single image or single vision?
Double vision, ma'am.
Double vision, right? Because in one eye it is macula, and in the other eyes it is non-corresponding point, that is the other extrafoveal point, fovea and extrafoveal point. Okay, so this diplopia, or this thing, so what the brain will do, so why to take, or why to have all these complications, so they'll start suppressing. Okay, so they will not try to fuse that. Okay, so they'll try to suppress that. Okay, so that leads to what it will leads to. So if it is start suppressing that, so then the brain will not take the images, and it will encourage the ignorance of that image, or ignorance of that eye. So that leads to again strabismus. Okay, so how much? So forget about all the things that is present in the slide. So in a simple words, I'll tell you. So horror fusionist means, so the brain will not encourage to fuse, because we are giving the images very slowly to the macula or the fovea. Since we are giving very slowly, so what happens? The diplopia and all this experience, in order to suppress all these things, it will start ignoring the images from that eye, and that can leads to manifestation of the deviation. Okay, clear?
Yes, ma'am.
Okay, so I mean, these people, this all these things, this horror fusion is related to horror fusion is said by, when is your next class? 310?
310, ma'am.
Okay, so this horror fusion is explained by different scientists. So one is said by, so what is horror fusionist and when will happen is by Bell-Chowsky, and next one is, so Van der Hove also added weightage to this thing that if child did not have a strong fusion mechanism, so the result will be double fusion. Okay, because diplopia is most disturbing, so the child would soon instinctively find it less annoying if one eye were turned. Okay, so since when you are slowly bringing the images, the brain will perceive diplopia. So since it is diplopia and the diplopia will be very bothersome to manage, so it will start suppressing and it will start it will ask the eye to turn either side. Okay, when I say ask means it will start ignoring, then thereby it will leads to deviation. Okay, so this is how in a children, okay, if they don't have a good fusion mechanism or good strong fusion mechanism, and because of this reluctance to the fusion and because of the diplopia phobia, okay, so they will not achieve the single vision and that leads to manifestation of the deviation. Okay, so now if you are, for example, there are few instruments and there are few things, tools, I would not say tools, but there are few tests that can actually reverse this things and thereby achieve good fusion mechanism and you can reverse the condition. Okay, clear?
Yes, ma'am.
So this is all about fusion mechanism and diplopia phobia. So one is a phenomenon is that is 1 minute. One is horror fusion is that means reluctance to fuse, and the next one is because of having diplopia and because of scared of diplopia, they don't encourage to fuse and they will start suppressing and that leads to strabismus. Okay, this is all about today's topic. Tomorrow I'll tell you the different theories, reflex theory, reflexologic theory, and because of all reflex and everything, and next muscular theory, innervational and genetics related to strabismus, all these things. Okay, if you have any doubt, please let me know. Any doubts? Yes, no?
మ్యామ్
Not in the
హారర్ ఫ్యూజన్ లో బైనాక్యులర్ అంటే బోత్ ఐస్ తోటి ఉంటుందా లేకపోతే సింగిల్ అయ్యా మ్యామ్?
both I say. Okay, ఎందుకు అలా అవుతుంది అంటే
అవాయిడెన్స్ ఆఫ్ బైఫోవియల్ స్టిమ్యులేషన్ అంటే బోత్ ఐస్ తో కాదు కదా మ్యామ్?
అవాయిడెన్స్ ఆఫ్ బైఫోవియల్ స్టిమ్యులేషన్ అంటే ఏంటి? రెండు ఫోవియా స్టిమ్యులేషన్ మీన్స్ యూఆర్ స్టిమ్యులేటింగ్ ద ఫోవియా, అంతే కదా. యు ఆర్ అవాయిడింగ్ ద స్టిమ్యులేషన్ ఆఫ్ బైఫోవియల్. ఎందుకు అవుతుంది అని అంటే దట్ ఈస్ అ ఫినామినన్. ఓకే, సో ఎందుకు అలా అవుతుంది అని అంటే ఇఫ్ యు ఆర్ ప్రొజెక్టింగ్ ద స్లో ఇమేజెస్ టు ద బ్రెయిన్, సో ఇట్ విల్ నాట్ ఎంకరేజ్ టు ఫ్యూజ్ దట్, యాజ్ సింపుల్ యాజ్ దట్. ఓకే,
ఓకే మ్యామ్.
ఇది మళ్ళీ BV1 లో కూడా వస్తుంది, నేను చెప్తాను దీని గురించి. సో దెన్ యూ కెన్ కోరిలేట్ దిస్.
ఓకే మ్యామ్.
మ్యామ్ ఒకసారి ముందు స్లైడ్ పెట్టరా?
దిస్ వన్,
ఇంకా ముందు మ్యామ్ ఆ వర్త్
దిస్ వన్,
మ్యామ్ దీనికన్నా ముందు అంటే ప్రీవియస్ క్లాసెస్
previous classes. Okay, which one you want?
దిస్ వన్ మ్యామ్. మ్యామ్ ఆ లాస్ట్ పాయింట్ ఒకసారి ఎక్స్ప్లెయిన్ చేయాలి మ్యామ్. వర్త్ రీజన్ మస్ట్ బి రిజల్ట్ అవుతుంది.
ఓకే, సో వర్త్ ఏమన్నాడు అంటే వర్త్ రీజన్ మస్ట్ బి ద రిజల్ట్ ఆఫ్ ద ఈసోట్రోపియా. ఓకే, వాట్ ఈస్ దట్? ద ఈసోట్రోపియా మస్ట్ బి ద రిజల్ట్ ఆఫ్ కంజెనిటల్ టోటల్ absence of fusion faculty. Okay, that is, again he said that when in fact if the patient's inability to fuse properly resulted from well established suppression mechanism rather than primary fusion defect. So he's saying two statements at the same time. What he said, esotropia is maybe because of the complete absence of fusion faculty and or fusion mechanism, and at the same time, but in some patients, okay, in fact, okay, rather than calling it as absence of fusion mechanism, you can call it also the person is having a greater suppression mechanism. Okay, adhamayinda? So that is the సో నాకు కంప్లీట్ గా ఫ్యూజన్ మెకానిజం absent అయిందని చెప్పకుండా, even though you have a good fusion mechanism, rather than having a good, absence of good fusion mechanism, so you are actually having a greater suppression mechanism. That is the reason. So that is the reason you are having a isotropia. Okay. Okay. Any other doubts, anyone? So far have covered till horror, fusionists and diplophobia. Now from tomorrow onwards, I'll teach you the theories. So you have to be very, careful, and you have to pay attention after theories. So we will complete this module. Okay. So we'll be completing this module with the completion of the theories. Okay.
Okay, ma'am.
Okay, ma'am.
Okay. So go through the textbook if you have, and prepare your own notes. Okay. And if you have any doubts while preparing notes, you can just take the pictures of that and send me. I will correct it. Okay.
Okay, ma'am.
And I'm not going to send the presentations for you.
Okay, ma'am.
Any doubts? If no doubts, we can leave here. Yes? No?
Ma'am, attendance.
Ram?
వేస్తాను, నేను చూసుకుంటాను.
Okay. Any other doubts, Megan, other than attendance?
No, ma'am.
No? Okay. Chalo, thank you. We'll leave here, okay?
Thank you.
Okay, ma'am. Bye, ma'am.
Bye-bye.
థ్యాంక్ యూ మ్యామ్. బాయ్ మ్యామ్.